Good morning. Today's talk is on morality, medical ethics, and professionalism. I'm Hugh Hagan. I'm a member of the section of hand surgery at Carilion Clinic Department of Orthopedics, and I have no pertinent disclosures for this meeting. So why do this presentation? Morality, medical ethics, and professionalism are a daily issue in the practice of medicine and surgery. A basic understanding of the evolution and practice of medical ethics is an important part of current physician education and is now reflected in training and board certification testing. The application of the principles of morals, medical ethics, and professionalism dictate how physicians will interact with their patients, healthcare facilities, industry, the general public, and one another as healthcare providers. So in this talk, I intend to discuss definitions of moral, ethics, and professionalism, to present a brief history of medical ethics as it has evolved, and to consider ethical issues faced by physicians on a daily basis. The definition of morality. Common morality transcends cultures. It does, for instance, most cultures believe that you shouldn't kill, lie, or steal. Particular morality refers to beliefs and behaviors that bind a culture, a community, or group together because of their cultures. For instance, certain nations, professionals, religions, and so forth. Common and particular morality often require that people sacrifice their own short-term interest for the benefit of society. And community or professional ethics are always going to be interpreted in light of what is considered moral by your society and community. Ethics is derived from the Greek word ethos, which means a way of living. And ethics is a branch of philosophy concerning human conduct, more specifically the behavior of individuals within a society. Medical ethics is concerned with the obligations of doctors and other healthcare providers, as well as institutions, to the patients and other healthcare professionals in society at large. Medical ethics deal with moral choices of medical conduct when all related circumstances have been considered. Medical ethics deals with the distinction between what is considered medically right or wrong at a particular time and within a particular culture. And medical ethics have not been static rules of behavior. What was previously considered appropriate may not be considered so today. That is, morality is tempered by culture. According to Webster, professionalism is the skill, good judgment, and polite behavior that is expected from a person who is trained to do a job well. Medical ethics and medical professionalism are obviously closely linked. Medical professionalism assumes rights and responsibilities. The physician is considered society's agent, and as such has delegated authority in matters of healthcare delivery. Physicians do have certain privileges that others do not have, because it is assumed that unless the physicians hold these rights and responsibilities, the health of society at large will be compromised. This is a social contract, and it is at the heart of medical profession. And physicians must always use their best informed judgment when caring for individuals who need assistance. And in return, physicians must be given appropriate freedom to do so. Hippocrates, Greek physician, lived in the 5th century BC. He is famous for the Oath of Hippocrates, which talks about the physician's relationship to the patient, that being the patient is paramount, and first doing no harm in the course of your treatment. There have been many revisions of Hippocrates' works over time, and in fact, very little original work that can be attributed directly to him still exists. The corpus, or first text of Hippocrates, lays out the foundation of modern medical ethics. Galen, a 2nd century AD physician, was famous for formulating early physiologic principles of disease, and these served as the foundation for medical practice for centuries. He was a strong supporter of Hippocratic principles of patient care and physician and patient interaction and behavior. Avicenna, who lived in the 11th century AD, was an Islamic scholar who lived during the Golden Age. He wrote extensively on mathematics, astronomy, law, and medicine. His Canon of Medicine, written in 1025 AD, consolidated the works of Hippocrates, Galen, and the philosophy of Aristotle, and became the practical and ethical guide for the practice of medicine for many centuries. During the era between the fall of the Roman Empire and the Italian Renaissance, which is the early Middle Ages, physicians, literate medical knowledge, and organized religion all became tightly bound through universities that were founded in Europe and in the Middle East. At this point in Western Europe, there was scant Asian input. There were strong contributions from both Christian and Islamic cultures. Late Middle Age medical knowledge grew in the universities, but much of the medicine and surgery that was practiced at the time was practiced by non-university trained practitioners and barbers. Middle-aged writers documented the ideals of physician behavior and physician-patient relationships. The physician was to be educated, was to be of high social standing, a master of the humanities, courteous, willing to serve all seeking help, regardless of their means, and the physician would be empathetic to the needs of the patient at all times. Thomas Percival, who lived from 1730 until 1804, authored the book Medical Ethics, a guide for the behavior of physicians and surgeons. This book was the first time the term medical ethics appeared in publication. He considered the practice of medicine to be a public trust, and that public trust demanded a particular level of behavior by physician and patient. He established a physician's code of conduct toward patients, regardless of means, and his ideas spread to the Americas, Australia, and Canada. The American Medical Association Code of Ethics, introduced at the founding of the AMA in 1847, used passages directly taken from Percival's book. In the United States, there were many forms of alternative medicine, and multiple medical schools flourished until the mid-19th century. There were no standards of medical training or licensure during this time. Standardization of medical training and licensure was formalized by the New York Medical Society in 1845, and in 1847, the AMA was founded, and the founding documents codified the AMA Code of Medical Ethics. In the late 19th century and early 20th century, as scientific principles became applied to medicine and surgery, human experimentation to test scientific discoveries became much more common. Needless to say, there were significant deficiencies in the conduct of these experiments. Early human experimentation lacked guidelines for informed consent. Osler in 1907 recognized this deficiency and suggested the formalization of informed consent. The post-World War II Nuremberg trials looked at wartime human experimentation. The Nuremberg Code enumerated 10 principles by which human experimentation could be conducted in a safe manner with appropriate informed consent. Interestingly, the Nuremberg Code was slow to be adopted by the established medical profession. Henry K. Beecher, an anesthesiologist and medical ethicist who trained at Harvard and worked in Boston and Harvard for his career, wrote a paper in June of 1966 that was published in the New England Journal of Medicine, entitled Ethics in Clinical Research. And in his paper, he reviewed 50 published articles involving human subjects that exposed the subjects to considerable risk, and found that 22 of the 50 had inadequate or no documentation at all of informed consent for the patient. His work led to a subsequent congressional investigation and the adoption of national and later international guidelines based on the Nuremberg Code that now govern human experimentation. The ethical pillars of human medical research, derived from the works of many of the people that I've been talking about, include the concepts of autonomy for the patient, beneficence toward the patient, non-maleficence with the patient, and justice for all patients. Autonomy is considered the foundation of medical ethics. It considers all people to have unconditional worth, and it considers all people to possess the capacity to make decisions about issues that affect them. Physicians are thus obligated to be truthful and to maintain confidentiality, to allow the competent individual or their representative to make an informed decision based upon transparent facts. Beneficence obligates the physician to act in the patient's best interest at all times. This is a positive requirement. These are things you should do as a result of the privileges bestowed upon you as a provider. Non-maleficence is somewhat the opposite of beneficence, is the physician's obligation to do no harm, as derived from the Hippocratic Oath. For non-maleficence to apply, you need to avoid negative behaviors. There are things you should not do. You need to balance risk versus benefit. You need to resolve ethical conflict within decision-making. Justice refers to equality of care and opportunity. It refers to fairness in the distribution of resources. It refers to the physicians and other caregivers' awareness of conflicts of interest. And it demands elimination of biases in decision-making. The principles of medical ethics should be applied to all physician interactions that occur with patients in both patient care and in medical research. Physicians are obligated to continue to study and improve upon skills and knowledge so they can take better care of patients. Healthcare facilities to perform patient care and administrative duties and to avoid inappropriate financial entanglement and conflict of interest. Industry to keep up with current medications and medical devices and avoid inappropriate financial benefit and conflict of interest. And the general public by serving and by being visible within the community, but avoiding misleading or deceptive representations of abilities, services rendered, and results. And finally, the principles of medical ethics refer to our interactions with one another, which should be collegial, polite, and available to assist colleagues in person or in professional need, to self-police our profession. The principles of clinical ethics and their application to the practice of medicine morality serves as the foundation for patient care, and the known ethical principles of beneficence, non-maleficence, autonomy, and justice rest upon this fundamental foundation of morality. Professional virtues are further expression of ethical principles, with compassion, conscientiousness, discernment, integrity, and trustworthy behavior all being paramount. These lead to the ability to care. And if you add knowledge skills and practice-based learning skills to your knowledge of caring and your ability to care for a patient, this provides optimal patient care. The care of the patient, therefore, is based upon a moral foundation that supports ethical principles, professional behavior, ongoing education, and development of skills, all of which lead to the best care of the patient. Fortunately, our professional organizations provide us guidelines founded on the AMA Code of Ethics to assist members in the application of ethical behavior in personal and professional life. The AMA also has CME training modules on issues in medical ethics. The American Academy of Orthopedic Surgeons Standards of Professionalism is divided on their website into easy-to-use subheadings. And finally, the American Society for Surgery of the Hand applies AMA and AAOS guidelines to the practice of hand surgery. These standards are easily accessible, and they can help members resolve ethical dilemmas when they are encountered. The AMA Code of Medical Ethics serves as a foundation for other subspecialties, standards of behavior and professionalism, and I'll go through them one by one. First, a physician is dedicated to providing competent medical care, compassionate and respectful for human dignity and rights. The physician is expected to uphold the standards of professionalism, to be honest, to strive to report physicians who are deficient in character or competence, or engaging in any kind of illegal activity to appropriate entities. A physician will respect the law and recognize a responsibility to his patients to seek changes in those requirements or laws which are contrary to the best interests of the patient. Physicians are expected to respect the rights of patients, colleagues, and other health professionals, and shall safeguard patient confidences and privacy within the constraints of the law. Physicians shall continue to study, apply, and advance scientific knowledge, maintain a commitment to medical education, make relevant information available to patients, colleagues, and the public, obtain consultation, and use the talents of other health professionals when indicated. The physician shall, in the provision of appropriate patient care, and except in the case of emergencies, be free to choose whom to serve, with whom to associate, and the environment in which to provide medical care. The physician shall recognize a responsibility to participate in activities contributing to the improvement of the community and betterment of public health. The physician will, while caring for a patient, regard responsibility to the patient as the most important thing, paramount. And finally, the physician shall support medical access to medical care for all people at all times. So in summary, I would like for you to consider the evolution of medical ethics from ancient times to the present. To recall the four principles of medical ethics: autonomy, beneficence, non-maleficence, and justice. To understand these four principles serving as the foundation of medical ethics as they relate to the physician's rights and responsibilities regarding patient care and research, the physician's interaction with healthcare facilities, such as pharmaceutical companies, hospitals, and device manufacturers, the physician's interaction with the public and their communities, how physicians interact with their medical colleagues. A list of references is provided here. Starting actually with the orthobullets chapter, you can learn quite a bit and get some decent references. I would also suggest A Short History of Medical Ethics by A.R. Johnson. It's a 2008 book. and Ethics in Clinical Research by Henry Beecher, published in 1966 in the New England Journal. I'd like to thank Dr. Hugh Kraft as well, who provided me some advice and also allowed me to use a PowerPoint presentation that he had done to the Pediatric Grand Rounds for Carilion Clinic last year, which gave me some references to lean on for this talk. Thank you very much.